Latin America? You gone to Latin America? No. Europe. Yeah. How about you, Dr. Cruz? Jerry, have you been to Latin America?
I've been to Honduras
Huh?
and Mexico.
Wow, Mexico, yes.
We might have to add more chairs. We are almost out of room.
Ah,
I just wanted to come share the good news.
that's good.
You can start now, but I just saw someone and so these chairs have been
Honduras 5 times with Sociedad Obispo Salus,
I love it.
really medical religions. And so we were public health and remote workers.
Oh,
And I'm a family physician, so
yes.
they had a lot of sugar cane workers up there. So we learned pretty quickly, bring your steroid shots, get their throats and shoulders going, have an interpreter that speaks Spanish, that takes them aside and tells them the physical therapy things
That's
to do. We would
amazing.
go to places like Patero Grande and other places, Ceiba, and come back the next year. People come back.
I love it. That's good. Okay, I'm going to get started. Yep.
Hello, good evening, good evening,
Good evening.
good evening. Thank you for coming. Thank you for being here. We are going to get started. We understand that some people are still joining us, and so please, the more the merrier. We have chairs up here in the front if necessary, but we want to be cognizant of the time, and so we're going to go ahead and get started. Good evening, everyone, and thank you for being here tonight. We come together as part of the Massey Commission, a community-driven effort created to examine how our public systems function and to put forward clear calls to action for change. This commission was formed in the wake of tragedy. We were charged with the responsibility not just to review what went wrong that evening, but to chart a path toward a safer, fairer, and more equitable Sangamon County. Our work has centered on listening to families, to community members, to service providers, subject matter experts in their fields, and to those most impacted by gaps in our system. We have heard stories of harm and stories of frustration, but also stories of resilience, creativity, and determination. Out of this listening, we've worked together in 4 focused work groups to identify what must change in order to restore trust, ensure accountability, and save lives in safer communities for us all. Each work group has taken on a different piece of the puzzle, from mental health crisis response to education, housing, economic equity, access to services, and more. One of the most important lessons we've continually learned is that these issues are deeply connected. For example, a lack of economic opportunity shapes housing, which in turn shapes health, which in turn shapes all kinds of access people experience while using our public safety systems. The work groups have not just identified problems, they've built actionable recommendations for systematic reform. We shared a 6-month report at our halfway point. And now it's time to finalize those calls to action that have been recommended. So tonight is about sharing these calls to actions back with you, the community, openly, transparently, and with an invitation for dialogue. This process is not about quick fixes or surface changes. It is about deep structural shifts that require leadership, partnership, and community voice at every step. We believe these recommendations, if acted upon, can make Sangamon County a place where every person is seen, valued, and safe. As we move through the reports this evening, I ask you to listen for the connections between them. What you'll hear is that inequity in one area creates harm in another, but also that solutions, when grounded in community and equity, can ripple outward in very powerful ways. Together, we can take these calls to action forward into the next chapter of work and ensure that this commission's impact lasts well beyond tonight and well beyond these 10 months. This evening, we're suspending our usual operating procedures to have dedicated time to talk within our community. Before I invite Kelly Hurst up to help facilitate the rest of this evening's activities, we have a little order of business that we must do before we get started, and that would be move to have the meetings accepted, or the minute meetings from our August meeting where Ferguson Ford was in attendance. Okay, so moved, accepted, okay. Now, we can call Kelly up to the front. And I'd like to invite the rest of the Massey Commission staff. Oh, I'm sorry, all in favor of the minutes from August. Any opposed? Oh, okay, thank you, Bob. So moved. Okay, we invite also the rest of our Massey Commission staff, Sante Massey and Adam White, to guide us through this next part of the process and how we are going to transition. Yeah, it was a little, feedback.
Thank you. Good evening. Oh, I was waiting. Good evening. I can't move forward unless you say it back. I think we know how that works. I just want to thank you all for being here this evening. As you've noticed, the room looks very different. We have a very different procedure for this evening. Our process is as follows, that we will be listening and then having some time at our tables for discussion. This is the time when the community hears what's been going on and then is able to offer some feedback. You also will notice some posters up around the room that you are welcome to add to as the evening goes on. What we're going to do is hear from a co-chair from a group for about 10 minutes to share what they've done, and then break for 15 to have table conversations. You have feedback sheets on your tables right now. Those feedback sheets are also, please just do one feedback, one recommendation per page. So there's plenty of copies. There's also an online option you're going to see go throughout the PowerPoint tonight, because there's a QR code so that you can also offer your feedback online. That is for also people who are watching tonight but are not able to be here in person. So we're trying to accommodate as much feedback as possible. So we have a great ideas and a miscellaneous over here. Up on the wall. You have to be tall to do it tonight, apparently. Who's not at the table is an important question that we think we need to ask after hearing reports and hearing about who is here, but also who isn't here. These are questions that have already been asked, and that doesn't mean that we have done it exhaustively and that other ideas can come in. Other considerations that we should have is also over here. And finally, local funding sources. Look how it's all by itself. You know how important that is in order to do this work. Here's the thing. Not everything comes with a funding source, but at the same time, there might be funding sources available in Sangamon County that we haven't thought about yet. And we know that the answers are in the room with the community. So we ask the community to help do this. This is also an evening where what you will notice, you also have a QR code on your tables for one of the reports. That's just how they did it. We didn't make it mandatory that anyone do all their reports the same. So they looked very different, and they come in very different. I also will say that has their report that's a draft. We didn't want to make copies for tonight because those were drafts. So we're going to share as much as possible, and then we will put those on the county website so that you can read them thoroughly, because there's a lot of information in there. I also want to say this. One of the learnings that we have had around this, especially in the last couple of months, is that one of our work groups had too much work to do. It's a thing that we learned, and it's okay. And so with that particular work group, I think if we had to do it over again, we might split that up. And so that workload was just very, very heavy. So we don't have complete recommendations for all of our work groups tonight, and that's actually okay. This should not be a rushed process anyway. I would rather not rush this. This work isn't done that way. You will also notice that some of the language might sound differently. So for example, the law enforcement work group used the words like rationale, recommendations, benefits, and steps. That's how they were thinking about this. So I urge you to consider all of those as a call to action, and then, of course, thinking about who and what in our community does that. Hold on. Too much stuff. So many of the things that we have been learning, we learned from our friends at Ferguson. We have learned all along. We have watched their report. We have seen what they have done. We have learned from their mistakes, which I really appreciate them being very transparent about. And one of the things that was in the Forward Through Ferguson report, I want to read to you all to ground us for the work that we're doing. It's in a book quoted from their report, a 2010 book called Flack Catchers, 100 Years of Riot Commission Politics in America, by author Lindsay Lupo, and she examines 5 commissions that were appointed in response to race riots between 1910 and 1992. I'm going to say that second number again, 1992. She argues that historically these commissions are appointed to calm the public and give the impression that the government is doing something, that they give the appearance of action, but are little more than a tool to maintain the status quo, and that, quote, social and racial issues in the cities are not addressed actually by the commission. Lupo says that past commissions focused on economic revitalization to the exclusion of social issues such as racial tension, segregation, and discrimination. It is as though the commissions are urging that our society has moved beyond race. Thus, the problems must be purely economic, but race remains at the root of the violence, as evidenced by its very inception, with every riot here being the result of white law enforcement harming a black civilian. We have not moved beyond race. I say that to ground us in this particular work, to say we have heard those same things about our own commission, and we are committed to figuring out how to do this. We don't always need everybody's permission, which is not a phrase that ever gets me not in trouble when I say that. So I say that to say, as we ground ourselves in this work and you all hear these things, we do appreciate your feedback from them. And so I'm going to turn it over to Joanne, who is going to do the report for law enforcement.
Yep. Okay, thank you, Kelly. I know. Welcome, community. Okay, so these are the 4 work groups that I spoke about earlier and within our commission. Justice Collaborative, we did the 4 work groups. We heard from the Justice Collaboratory group from Yale, research and experts' recommendations. Your role tonight, we ask that you listen and that you learn and that you act and provide your feedback, please. Okay. Did you explain, where's Kelly? Did you explain the Slido and how that works? Yes, okay. All right, so, I will. Yeah, oh, okay. Okay. Think everybody got that. All right, so I was a member of the Law Enforcement Hiring, Training, Wellness, and Cultural Competency Work Group. This work group was chaired by Sunshine Clemens, who could not be here with us tonight. She's traveling. And Deborah Anthony, raise your hand, Deborah, please, who was also the second co-chair. And we had 6 core goals that our group came up with that we thought needed to be focused on. And these 6 goals were, number 1, civilian-led crisis response. Number 2, transparent oversight. Number 3, modernized training for all helping professions. Number 4, officer wellness. Number 5, community trust. And number 6, diverse and values-driven workforce. Now, we'll start with the alternative crisis response. We have been in meetings, and we have heard from experts, and we have learned that law enforcement is not necessarily the right group to address our mental health calls, especially mental health calls that aren't grounded in violence or any type of violent behavior. And so we felt that, as many other states have done, we should work on trying to adopt or launch a county-wide alternative crisis response program. We heard from groups from Denver's STAR and Oregon's Cahoots, which are both states that have these programs already operating within their communities. We would want this to align with the Illinois Community Emergency Services and Support Act, CESA, that we already have here in Springfield and Sangamon County. We would want the dispatchers to be trained to redirect appropriate calls. We heard from the director of the 911 system. He came and spoke at one of our earlier meetings. And when it's left up to the 911 operators, call takers, to determine whether something requires a law enforcement response or a outreach mental health group type civilian-led response, that would require some training on their behalf, because they aren't necessarily going to know what dictates what type of response. And why it matters? Well, it saves money, number one. It reduces arrests that don't have to happen, and it prevents harm and builds trust. It leaves our law enforcement partners available to handle the calls that they are more suited for. That brings us to one of our second core goals, which was stronger hiring standards. What brought us together as a commission was the result of the tragedy of the murder of Sonia Massey. And what we learned, and what everyone learned as a result of that tragic event, is that comprehensive background checks of police applicants are not something that's optional. It has to be done. Comprehensive background checks with their former employers has to be done. Independent review and strict disqualifiers, statewide consistency in the standards. One agency shouldn't have one set of standards for hiring, and another agency have lesser or different sets of standards for hiring. That led us to officer accountability and decertification. We heard from groups that were familiar with officer decertification programs, and how, even though, in spite of the Safety Act's reforms, and even though that there are steps in place for officer decertification to happen, no one's really minding the store. There's no way to determine if departments are actually reporting when an officer should be subjected to decertification. There's no penalty for these organizations not reporting. So a lot of that needs to be shored up quite a bit. A public-facing database of officer misconduct, that should be available for the public to see. Centralized complaint routing system. Why does that matter? Some departments, a person can file an anonymous complaint. Other departments won't accept an anonymous complaint. If you have a centralized complaint routing system, things are more apt to get processed and get carried out as a result of an investigation. Why does it matter? It removes officers who pose risk, improves accountability, and therefore builds legitimacy. Elevated training standards. Now, you will hear varying reviews as it pertains to police law enforcement training. Some people say it doesn't work at all. Some people say it can only work if it's as good, if it's good material or good curriculum. One thing our group came to as a consensus is that it should not be computer-based. A lot of law enforcement training is computer-based. That leads an officer to sit in front of a computer terminal and just advance the slide. And they got a little savvy, and some of the training programs won't let you advance right away, or you at least have to scroll to the bottom of the page, click something, and then advance. But once people figure that out, it just adds maybe 10 more minutes to the training process, especially when you're talking about critical training, CIT training, anti-racism training, implicit bias training, how to handle autistic individual training. how to deal with victims of violence training. That should not be computer-based. That should be in-person training. We know as a group that that's going to result in expense because, you know, someone's got to be hired to bring in that training. Someone has to be certified to give that training. But we feel that that's also something that's non-negotiable. Annual legal updates. And then earlier crisis intervention access. We learned that in the majority of the departments here in Sangamon County, an officer cannot participate in CIT training until they've been on the job at least 3 years. Well, what happens if they get into that critical incident in year 1 or 2? So we think that it's something that should be introduced in the academy. When an officer's in the training academy and they get a certain hours mandated by Illinois state law of training, offer the critical incident training at that point. Now, we understand that certain departments have critical incident response teams. And if you want to make that a more selective type of thing, where an officer has to apply, express interest, show why they should be a part of the team, that's fine, but at a minimum, every officer on the street should have the basic critical incident training from the moment that they're out on the street. Officer wellness and resilience. We know that an officer can't be expected to do a good job if they themselves are not in a good place mentally. And there is also a huge stigma within law enforcement of admitting that you're not okay. Even though in 2025, everywhere we see, we are reminded that it's okay to not be okay. But I'm here to tell you from experience, that does not bleed into the law enforcement community. It's not okay not to be okay. Afraid of job loss, afraid of stigma, afraid of being ostracized, all types of things that prevent officers from coming forward when they should be coming forward. So, we want peer support and post-incident briefings. After every critical incident, there should be a post-briefing. There should be an opportunity at those briefings for mental health, peer support, and a chance to speak to someone if they need to. And normalize mental health resources. Why does it matter? It reduces burnout, improves safety, and supports good officer decision-making. Community engagement and trust. A dedicated engagement staff and team. Regular forums and advisory boards. We know there are some that exist right now, but they fail sometimes and could be shored up to be better. And transparent policing data. Why do we believe that this matters? It builds lasting relationships, not one-time conversations, ongoing conversations. Recruitment and retention. And this is something that is difficult across agencies. Every police agency that we heard from said that they are struggling to get good applicants in the door. And so we asked, what are you doing to reach out to potential applicants? What are your strategies for doing that? So we need to target an outreach to diverse candidates. I can't be what I can't see. So if I can see someone that looks like me, if I can see someone that grew up in my neighborhood, then maybe I could see myself in that position. Partnerships and internships for local pipeline. Reach these children when they're young. And if they have an interest in law enforcement, that's a good time to try to reach them and maybe do some type of onboarding program, internship program, something that might get school credit, something that might make them more drawn to the occupation. And then modernize standards and grow your own programs. Programs that, again, will cultivate applicants from within our own community so people can go back and work in their community. Why it matters. It would create a workforce that reflects the community's values and expectations. Our path forward together, from recommendations to community-driven action, aligning Sangamon County with equity, safety, and accountability. I know that was fast, but we have to get through every group, and then when we get out at our tables, we can discuss all of these more at length if you would like to. Thank you.
That was a great presentation, and the work of that work group was fantastic, as was the work in all 4 work groups for sure. And just so everybody understands in the audience, there are 7 general categories here, but each of the 3 points under them are a call to action. They are an action item that we expect to be acted on as it's refined here toward the end. And we really do appreciate your feedback for this.
Thanks for saying that. I just noticed something that's happening in the room. I watched a lot of people with their phones taking pictures of things so that as you all have conversations, you have them. We're actually going to cycle through the ones that Joanne just talked about as you all are talking at your table, so you'll have a chance to see them again as well. Just came up with that idea. Thank you, Adam. At this time, I'm going to ask the commissioners if they wouldn't mind going to join a table and having our discussions, and then coming on back, you might need to take some chairs over there. So we'll start a timer for 15 minutes, and then after that, we're going to go to the next work group that will go through it. You all could probably stay at the tables once you get there. So you will have some commissioners at your tables, and you will probably notice that some of the commissioners will get up and move to other tables to make sure that they can hear the majority of people in the room. So your feedback sheets are out there, and we have 15 minutes for our conversations, and I'll bring us back together. You got about 5 minutes left in this discussion. All right, if you all can bring your discussions to a close. I saw a lot of people writing. I heard a lot of great discussions. And we know this is probably not nearly enough time. You all can stay there. Commissioners can stay where you are. And I'm going to ask Brian to come on up to do our Integrated Mental Health Services Workgroup report. You got it? It's better. Yes. I tried another one and it wasn't great, so I grabbed that one.
Kristen and I decided we're not good enough. We're doing it sitting down.
Yeah, yeah. You want me to wait? You're right. You want me to go? All right, I've been asked to get things going for the mental health work group report.
As Brian is getting ready to give us our next report, I'm also wondering if there would be at least a person at each table willing to collect those notes that you're taking on feedback for us, and then we'll come around and gather them up. Take it away, Brian.
All right, to start things off, I guess before I start, I wanted to give acknowledgement to a few work group members who are here. Emily and Jenna, if you wouldn't mind raising your hands, and Vinod over there, if was also part of the work group. So wanted to give. It's hard to hear. All right. So I will be, in the 10 minutes I have, I'll be largely walking through the headline descriptions of our recommendations. So I would encourage anyone who has access to the report to pull up the QR code and save it and send it to anyone else that would like it. There ended up being 5 areas that our issues and recommendations fell into: crisis response, crisis dispatch, youth services, court services, and access and equity. In those areas, there were 12 issues identified, 12 problems, 12 concerns, 12 things that needed addressed in the community. Of those 12, each of them had recommended actions. Some had 1, some had 4 or 5. Ultimately, we ended up having 27 recommended actions for those 12 issues in those 5 areas. I will be walking through them. But before I do, would point out there were what we called 5 cross-sectional considerations that would be applicable to the implementation of the recommended actions, not just, frankly, for our work group. It would be applicable for a lot of the other recommendations of the other work groups. They were, of the cross-sectional considerations, ensuring diverse dissemination of the Commission's recommendations, productive integration of anti-racism, cultural competency, and other related training models. 3, addressing applicable language and identity barriers in any implementation of recommended actions, ensuring continuation of Commission's work in some form, and 5, promoting transparency through evidence-based metrics where possible. So in the first focus area of non-law enforcement crisis response, issue 1 that was identified: limited availability of crisis resources. That's actually, it'd be easier to, because they don't always. So in those, oftentimes co-responder and mobile crisis unit are the 2 terms used a lot. Co-responder being when non-law enforcement goes out with the law enforcement. Mobile crisis when non-law enforcement potentially does the response themselves, either in person or through phone. That would be the 988 or the Memorial Health Mobile Crisis Line. So the recommended actions with regards to limited availability of crisis resources. Recommended action A involves a review of statutory and grant manual requirements for potential expansion of those who are qualified to provide non-law enforcement behavioral health services, while of course trying to respect this, the integrity of the service being provided. This would be an opportunity for more access without more cost. Recommended action B for limited availability of crisis resources in the near term The reality is we have grants that are up for renewal every so often. One that would need to be encouraged, but there would be others, would be Springfield Police Department Core Grant. This is the co-responder grant that they've had on a 3-year cycle, I believe. Recommended action C for this issue, development of long-term funding streams. This is one where 708 board will be essential for long-term funding. 708 board is going to make an appearance several times in these recommendations. Issue number 2 for non-law enforcement crisis response, limited policy consistency and guidance. This is largely not necessarily solved, but led by conversations regarding the Community Emergency Services and Supports Act, CESA. So a few years ago, a law was passed here in Illinois that reviewed the 13 or so non-law enforcement crisis response laws around the country, including Star and Cahoots, and then passed it and has been working on implementation. It literally just started being implemented this summer. So recommended actions, A, in the near term, assessing those outcomes in the initial term. With it just starting, there's not really a rubric exactly for the timeline, but there should probably be a concerted effort to do an initial assessment in its first 6 months. Recommended action B, also in the near term, supporting public education of CESA and 988. The state actually has provided a template for that communication, but the work that we could do in our community is making it locally tailored and disseminated. Recommended action C with regards to limited policy consistency and guidance regarding CESA is after these initial assessments, expanding the service being provided to beyond the lowest risk. It is a 4-tier risk level that they are doing. Right now the pilot is only for the lowest risk, lowest safety risk going on, where there's already anecdotal evidence that it's not really being utilized all that much. Some of it may be related to public education, but a lot of it is related to the fact that at the lowest risk, a lot of those situations can be handled by phone. So a lot of in-person services are not yet being utilized, so as soon as it can be done safely, expansion of that. We have a very prominent role here in our community of our Central Dispatch Executive Director and Memorial Health being part of the Region 3 Advisory Committee. So those stakeholders would be important to engage. The second area of focus was crisis dispatch process and protocols. There was really kind of one overarching issue with regards to dispatch protocols that was referred to as the issue of technical system coordination and training gaps. There's a reality of this being a complicated system with multiple entities and it being in a high-stress environment. The recommended actions, A, are invest in the near-term system upgrades and accreditation-related trainings. The reality is our county actually, Central Dispatch had started prior to 2024 to look into upgrading its training and its technology, as well as accreditation through a national service that would require more audits and reviews and reporting. So this is kind of the time and one of the few areas where we do make a specific investment recommendation for the county that so long as I guess Chris Mueller doesn't come asking for the moon, that we take the opportunity right now to make that investment with CESA rolling out, AI being available, and the accreditation potentially coming soon. The other part of then the recommendation is transparency metrics to track and publicly report on outcomes. This would have a dual purpose of metric tracking of the successes as well as public knowledge of what actually is going on. The thing that to note here is that this would not be able to be just a central dispatch issue in terms of responsibility. It can't just be thrown on them. They are not the repository of the final outcomes. That is often with the departments that the dispatch goes to or the final destination of care. So whomever takes that on is going to have a significant leadership coordination responsibility. Area C, youth mental health. For this area, a lot of the issues we focused on were school-based. There certainly are many other areas potentially, but there was a reality in the time we had that 75% of a year, our kids and families have one of the highest touch points at our schools. So that was where some of our focus was for some of these recommendations. Issue 1, though, regardless of whether it's a school environment or not, issue 1 is limited understanding of youth-focused mental health service needs. We know there are gaps, we know there's a lack of access, but beyond some recent studies that did pinpoint a few clinical areas, there doesn't seem to be a really good understanding of what exactly the needs are of our youth. And so a recommended action would be to review some of the studies that have been done recently. Sangamon Recovery-Oriented Systems of Care recently completed one. It is on page 6 of the report with a hyperlink to the FY25 survey they did, as well as the one they just opened, as well as the survey that the 708 Boards County Mental Health Commission did a couple months ago. If needed, the recommendation is to go further and do more reporting for not just the clinical areas, but areas of potential unmet needs with regards to crisis response, mentorship, peer support, and resilience building. Issue 2 with regards to youth mental health, challenges to school clinician recruitment and retention. There is a lack of clinicians that are available in the schools. Mosaic is a program in 186, but it isn't for all of the schools. It is limited in its availability and access. Even when it is available and accessible, there is a high turnover and reliance of entry-level clinicians. And that's a reality to the challenge. So recommendations are, this is one where there should be engagement of the local medical providers, academic partners, and former school clinicians to assess the workforce deficiencies. And then this is kind of a two-parter that's really tied to one, publish the findings so that we can all have that conversation about what those actual workforce challenges are and what we can maybe do to make it better. Issue 3 with youth mental health, lack of consistent and trusted environments for youth mental health. In this, we have recommendations, several of which one is support the expansion of Springfield District 186 Peace Room program, which was begun very recently in years, replicated or adapted from models throughout the county. This is a safe space for students to regulate emotions, practice resilience strategies, and consistently connect with supportive adults that are not necessarily always clinicians. They can be and are at times, but they are otherwise an adult that a student is consistently able to interact with, and some additional training is provided to them in those in-district or in-school locations. Recommended action B, beyond designated locations in schools such as peace rooms, provide or support more access to social emotional regulation tools. These would be things like headphones or other stress response equipment and toys. Recommended action C, support, replicate, and adapt other school-related programs or programming. So the reality is there's things other than the in-district or the in-school peace room scenarios or other stress response tools. Program examples we gave in the report are things like District 186's WEB, Where Everybody Belongs Intergrade Mentorship Program. It was covered by the school board a couple meetings ago if anybody wanted to look at that more. Fairview Families Weekly Support Activities is another example that we provided in the report. And then tying it all together, any new expansions or new programming should cross-reference any new studies about the specific unmet needs. Issue 4, last issue of the youth mental health, acceptance of mental health and related services in schools. The reality is new laws and policies and regulations have been getting passed the past few years. And in particular, over this next year, there will be implementation of several. So recommended action A, engage education and community stakeholders with the new state mental health and social emotional learning assessments, as well as adversity and resilience support tools that have been developed by the State Board of Education with local and state stakeholders. And then B, tied to it, this is another really one action tied, split into two, promoting public messaging. So some of the training and support is in the schools themselves with the practitioners, but it'll be important to have the public messaging so that the families and the teachers and the administration are on the same page. D, mental health court. This is a fourth focus area, mental health court and probation services. We tended to look at the problem-solving court process. There are several, a couple of which focus on mental health and substance abuse. And oftentimes these individuals are brought into the justice system but not necessarily incarcerated. There's also a reality that we didn't necessarily have time to touch on of the incarcerated individuals with a high level of mental health need. but would encourage you to look at the link that we provided. It was covered by this 708 Board Commission as well. And the recommendations do have some translation to the incarcerated community. The issue identified: continuity and transition challenges after the problem-solving court participation. So what happens after you go through the program, you graduate and complete? That is a issue. Even with the structured support, those gaps have emerged. So recommended actions: stakeholder engagement and planning. In the near term, at least, there's an opportunity for a group. Sangamon ROSC has been trying to do this, whether it's them or someone else, bringing the entities and stakeholders together to talk about what can be done in the transition period after someone has gone through the problem-solving court process to identify the service gaps and potentially develop strategies. And then more in the long term, this is another for 708 integration and prioritizing the financial support. I'd also point out that 708, if it does end up happening here in the county, it's going to be more than just about money. Money can influence policy, so that will also be an important part of anything 708 Board does. Finally, the last area we had, access and equity with mental health services. These are kind of some of the bigger issues that aren't as easy to pinpoint, but some of the issues that we touched on with regards to mental health services, I don't know that irony is the word, but there is an issue that over all of these issues where we found that there are a significant amount of resources and medical providers in our community, yet there are still service gaps, there's still fragmented care, there's still people with unmet needs. So some of these issues tie directly to that. Issue 1, siloed services and inadequate continuity of care. We heard some of that with the court services, but the reality is continuity of care exists elsewhere as well. In the near term, similar to the past subject matter area, support for community organization coordinators. Sangamon ROSC could serve in that role in the near term in particular to strengthen cross-entity communication. And then more in the long term, leveraging the 708 Board for forcing some of these silo walls to come down and better continuity of care. The last few issues, distrust and misunderstanding between providers. And this is the access and equity focus area that we're in. So with the issue of distrust and misunderstanding between providers, we heard several examples of things like a misunderstanding between various entities that are involved in a mental health crisis or non-crisis situation, of not understanding why there was a medical intake refusal, capacity limitations in court services, unclear boundaries for law enforcement duties. Recommended actions: convene a summit of key stakeholders to address these issues and potentially form actionable solutions, as opposed to engaging in. There are some recommended actions where an entity could go out and get the information. This is one where the decision makers probably need to come together and actually have the conversation. Summit style gatherings like this are an efficient way potentially to have, quote unquote, the important people in the room to figure things out. And that's more in the near term. In the long term, this is another 708 Board. But with this, rather than just focus on the funding and policy influence, if there's a capacity for the 708 Board, our recommendation is for the 708 staff or a staff to map available services, roles, and responsibilities, and would highlight one foundational element that would help in this mapping is whether it's a crisis or a non-crisis situation, the map should provide a point of contact or line of communication best practice for all of these different agencies that need to communicate with each other. The final two issues, limited public knowledge of resources available. So on page 10, we link to about 7 different platforms that are available locally in the state. It provides a lot of different access to a lot of different services that are available, yet, as we pointed out earlier, a lot of these things still aren't known. So in the near term, recommended action A is to expand and promote the existing platforms that do exist, getting that knowledge out there in the near term at a minimum. And then B, work on a longer term solution so that potentially there is an agreement on a single uniformly publicized comprehensive local resource that remains up to date. We did, on page 10 of the report, provide a draft example of that, of what could be done. I would point out that in doing that, we have 68 substance abuse and mental health providers, and the focus largely is on underserved communities. 78 residential services, so this is housing, food, clothing. 53 life development. This is childcare, youth development, education, legal services. If you would like to take a look, it is not meant to supplant anything out there. It is simply meant to educate what potentially we can do. Final issue, professional capacity and access limitations. So this involves the workforce shortages and access barriers that we have. Recommendation A, improve incentives for professional training, recruitment, and retention, beginning with review of private and public stakeholder recommendations. This is one where the word engagement got used already before, engaging those who provide the services so we can actually publicly be transparent about what solutions there could be. We just didn't have enough time to do that, so that somebody's gonna have to take that up. Last recommendation with regards to access and equity, assess the financial and non-financial barriers, including insurance, out-of-pocket cost, transportation needs, and potentially push that onto the 708 board to prioritize, trying to reduce those disparities. In doing that, I mentioned non-financial and financial, and while cost and transportation are examples of that, one other thing that the group wanted to highlight is to also look at the provider side of service, the barriers on the provider side of services. So these are things like the caseload and assignment and management. That is a reality for our service providers, which end up directly impacting waitlist quality of care and turnover. With that, on the final page, we linked to all of the minutes and material presentations that we had from any of our guests, and are happy to make that available. That's it.
Okay, we're going to take our time at our tables and have 15 minutes. And if you need some more feedback sheets, let us know. We're at about 5 minutes left. Okay, that's our time for that work group. We're going to ask Kristen to do community education on public health and safety. and we will once again have 15 minutes for discussion.
Okay, can you hear me? Hello. My name is Kristen Rubelke. I am one of the co-chairs of the Community Education on Public Health and Safety Work Group. First of all, I just want to also recognize my work group members who are here. Derek, we've got David, we've got Bob, and Vanessa, and is Gail still here? Gail was here, but I just want to give a huge shout out because our work group has been really fantastic. We have licensed professionals, we have prominent community members, and all of the input that they had into the work group is really going to help shape a strong recommendation from our work group. So thank you all for the work that you've done. Our last work group meeting was on Saturday, so you will see that I have 3 slides for you all, and it is a fantastic 3, but I will put it all as concisely as I can and try to explain to you what I can as well. Our final work group meeting is on September 25th, so that's a Thursday. That is when we will actually finalize our recommendations. So for the majority of the recommendations that you hear today, these are likely recommendations. We have been talking about these often, but we have not yet voted on them. So I don't want to give any false perceptions that these are all going through as I say them, but we will move forward. With this in mind, so I do want to start with a couple of recommendations that we have voted on and have passed. So one of them is the Community Health Roundtable, and then the other one is the commemorative plaque. We, as a work group, wanted to acknowledge with the Community Health Roundtable that other community groups have studied issues and have made solid recommendations of value related to the mission of the Massey Commission. But these organizations have come before us. So we wanted to make sure that we included some of these recommendations. This work group did a report that worked on community health and policing. The report outlined national and local statistics related to disparities among communities of color in Springfield and their interactions with the police. So this was written in March of 2023. Everything that is here you will find is very much so still relevant today. These recommendations were also made only to the city of Springfield. So our work group voted that this be expanded to include Sangamon County. The commemorative plaque that we voted on is a resolution to recognize trauma that the community experienced with Sonia Massey's death. Her death had a profound impact on a community that was already divided when it came to policing. And so this coincides kind of with the Justice Collaboratory report that noted that in order for the community to adequately heal, our work group felt that these spaces needed to acknowledge and take ownership of the issues at play and the violence involved in policing in Sangamon County. So this commemorative plaque is not supposed to be a remembrance to one person. It is supposed to encompass violence that has happened in terms of policing throughout Sangamon County. And the language that's supposed to be put on this plaque is supposed to demonstrate efforts of healing to the community. Where we want this to be at is in the front of the county building. There's a planter at the front, and we want the plaque in the front of the county building because we need the county to remember, and we need citizens to also know that they have taken ownership of this. So those are the recommendations that we've already voted on. We've already sent them to the Massey Commission. This was back in April and June, potentially. The other areas that we have been working on throughout our time together, and these have all been areas that we have voted on and have been working towards resolution with. So different places that we thought with the community education on public health and safety, not only are we wanting to educate the public, but where else can we fit within education? And we thought accountability was an excellent space that is not really being covered. It wasn't mandated to be covered within any of the other work groups. So that's a space that we really wanted to highlight. So for the first recommendation that we have, and like others, are these spaces are going to have multiple recommendations within them, so bear with me. I know I didn't put these all in slide form, but I'll try to be as engaging as I can. But if you all remember, we were sitting in this room back in April, and Dr. Tripathy showed us a presentation where they had a ton of hot maps. And within these hot maps, there were different things that they were showing. And he called this the Social Vulnerability Index, which when you moved from slide to slide, it included income, education levels, levels of poverty, early childhood education, life expectancies, etc. Well, what did we find within those maps? We found that those maps were very much so consistent throughout them. We found that vulnerable communities are vulnerable communities, and communities that are doing well continue to be communities that are doing well no matter what metric you put in there. So, and one example is he mentioned that in the Northeast side, they have a life expectancy that is 13 to 15 years lower than the national average. And there are areas in Springfield where it is significantly higher. So what does that tell you about the disparities throughout our community? So within this one space, we wanted to make sure that these are all issues that are top of mind for our elected officials. We wanted to make sure that we are holding our elected officials and the spaces that we encounter accountable for the disparities that we're seeing. And we want to hold them accountable to resolve these disparities and come up with a plan for ourselves. So the different spaces that we were looking at holding accountable are the city, the county, our education system, and 911 and dispatch. So again, we want to make sure that they're aware of the disparities, they're making plans to address the disparities, and we're not only making a plan that is looked at once, thrown in the corner and never looked at again. We want to revisit this and make sure that we are looking at this over and over again, making changes, making improvements, and making sure that this is a live, living document that helps our elected officials come up with solutions for our communities. Moving on to accountability and 911 dispatch, you'll see a lot of crossover with what Brian had to say in his dispatch group. We want to increase training and education, especially within anti-racism, de-escalation, cultural sensitivity to 911 workers. We also noted when we had Chris Mueller at our work group that there are a lot of jobs available within 911 and dispatch, and 911 dispatch actually pays a good amount of money for these jobs. So we want to make sure that they're marketing these appropriately to the community, and we also want them to increase diversity because diversity is extremely low within 911 and dispatch. There were recommendations to combine some of the protocol related to Sangamon County, Springfield Police Department, and the Park District. There's a lot of issues within those three spaces working together, so we want to work to resolve that. We also want to increase the number of 911 employees and training that they receive. And then another one that's very, very important is that when Chris Mueller came and talked to us as a commission as a whole, there is not a feedback loop for how community members interacted with dispatch. And so that is a huge gap. I think at first he said that people could email him. When he was at our work group next, he said, you know what, if you have a negative experience with 911 and dispatch, you should probably just call back, and then a supervisor can address the issue right away. So we appreciate him wanting to address the issues right away, but I think that we need a feedback loop, because within our group and within our work group, there's been a lot of really hard, challenging experiences that our work group members have had with 911 and dispatch, and so we want to make sure that there's a way that they're tracking what's happening on these calls and how the community is receiving it. Additionally, we're looking to potentially have first responders and communities meet in person so that they can address issues and barriers that prevent successful engagement and accountability. Chris Mueller also mentioned to us that he's looking into an AI system for quality assurance and quality improvement. There may be some recommendations that come from that. We didn't get that far in our last work group meeting. Know Your Rights campaigns. So not only are we needing consistent Know Your Rights campaigns for traffic stops, but what happens when somebody does not feel comfortable having a police officer at their home or in their home? It was very apparent with Sonia Massey that she was uncomfortable with the police officer being in her house, so much so she called dispatch again. So we need a 911, or not a 911, we need a Know Your Rights campaign on policing in homes. And then we also know that we talked to other work groups, and we know that we need funding for this, and we need consistency and support to get the message across. Oftentimes, these Know Your Rights campaigns come and go, but they kind of come and go in spurts. It's not something that's very consistent, and we need to make sure that they're consistent. Mental health and trauma in the community. Our work group did help support some community healing events throughout the month of July. Due to low attendance of those, we're not going to recommend that they move forward, but it is something that we organized, and thank you very much, David, for hosting quite a few of those. One thing that we do want to address is destigmatization of behavioral health. Stigmas continue to affect our community, affect the police, affect people, just regular residents who deal with behavioral health issues. And we want to make sure that we can reduce stigma as much as possible. We've also talked about siloed services, these spaces not working together or knowing about each other, and what can we do about that. And then an adequate resource list, like Brian mentioned as well. And then just to let you all know, I know I'm over my 10-minute mark, we are going to be utilizing some of the Justice Collaboratory resources and recommendations. These include community engagement and education on the topics of health and safety, long-term strategic planning, the community feedback loop with not only 911 and dispatch, but also with the police, and then some additional programming. Thank you.
Thank you, Kristen, and the work group members who are here. Your 15 minutes is starting now.
50 pounds.
I know.
Yes.
I hope that was good. That's
No,
what I'm
yeah, yeah, I
saying.
know. I had to. I was in a lot of knee pain and hip pain, so I went to Dr. Florence, um, Nicole,
Right,
you know,
Nikki.
Bobby's,
Yeah, yeah, Nikki.
And so, yeah, under her care and her doctors, and yeah, it's completely deliberate because I just felt sluggish and yeah, I need to
Great,
do something.
great.
Thank
Good
you.
for you.
Thank you.
Good for you.
Thank you. I don't know that people notice anymore.
Oh, yeah. Well, I haven't seen you for a while,
Yes.
so
So, yeah. So about 50 pounds.
that's great.
And I have more to go, but you know, little by little.
Yeah.
Mostly you have to change the way you live.
But my bet is you're feeling better.
Oh, so much.
Physically, yeah.
So much better. Definitely.
Okay.
Thank
We
you.
need to get together and catch up sometime.
Yes.
I've been sort of, I don't know,
Oh, yep, we will.
you know.
We will.
Okay.
Thank you. Your third.
Yeah.
Who was the first?
Miss 20, Monique Davis, and then another guy that was here. It's all new stuff. I've been on camera all day.
Yeah. I was shocked that she used the typical one-room word that Sonia Massey was uncomfortable. And I'm like, no, she didn't feel uncomfortable. She felt unsafe.
Unsafe, threatened.
And the other one was,
You can give her that feedback.
yeah, I will, cultural sensitivity. That's 90s.
I don't do that anymore.
And it's okay to say there's no person of color at our 911 dispatch to say very low diversity. Right?
There's none?
No, I'm saying
Oh,
if
yeah,
that was
yeah,
the
yeah.
case.
If that was the case, yeah.
Are there?
I have no idea.
That would be a good
That's a
question.
good question.
I'm going to ask her.
That's a good question. You got this. You can do this
I
in
got
10
it.
minutes. I promise. Yeah. No, I just promise.
I will.
Okay, we'll have 6.5 minutes left.
Okay, good. So, big, big scope. So, we're still working on recommendations that we will need again for me.
Don't apologize. Say, it's gonna take me more than 10 minutes. And I'm gonna say, woohoo!
I'm going to do your clicker. I'm going to do your clicker, no worries.
Thank you.
I'm just going to, tell them the time is up here.
I'm using this one.
Whichever one works, I can hand off this one, whatever you want. Okay, we're wrapping up our time, and we'll be hearing from our last group. Okay, our time is up. Time is up. So now we're going to hear from our final group. We're going to hear from Miss Veronica Espina. Do you have?
Hello. So, can we start with the slide? Okay, the very first thing that I'm going to say is thank you for our work group members that are amazing. Our co-chair is Dr. Sheila Caldwell, who is here. And we have Beth Langen, April Poole, and who else is here? Bree. Where's Bree? Yeah, Bree Roberts. Okay, so we're going to go to the grounded in focus areas. We have a lot to cover, and in fact, we don't have all our recommendations submitted because we had a huge scope. This is one of the cases in which we realized we had a lot of field to cover. So the group is going to talk about equitable access for marginalized groups, transparency in funding and services, inclusive economic development, fair housing, health, education, and transportation. That's a lot, so we'll do our best. All right, next slide. Access and inclusion. First, I want to tell you the definition of disability that we use, which is different. So I'm going to read it. To understand this disability analysis, we need to use an anti-racist definition rather than a white-centered one. This definition of disability includes the impact of systemic racism, poverty, and violence as causes and exacerbation of disability, which is the three cases that we have heard of: Sonny Massey, Earl Moore, and Gregory Small. So that is the definition that we're using. And we want, in terms of access and inclusion, we want our accountable bodies, city, county, 186th district, capital township, and so on, to commit to do an equity review and to review the policies. Are they in compliance with ADA, civil rights for housing, and so on. We also want to have diverse representation in governing and advisory bodies. We want anti-racism framed disability inclusion training. And these are the recommendations. So each one of these have recommendations and different points of recommendations, along with accessibility communication that includes interpreters, translation materials, and so on. The impact of inaction, which is the next slide, talks about reliance on family members or informal arrangements with persons who may be hearing or may speak the same language in legal and medical situation in particular, can be traumatizing for everybody involved. So the commission is aware that these are not regular practices by Sangamon County court systems to get, interpreters. Local city and county law enforcement, city or county, local schools, and some local hospitals, healthcare facilities engage in this. We need anti-racism center training, and like we were saying at this table here, talking, we can have a lot of anti-racism training and cultural competencies, but what we also have, not bad, and along with cultural competencies and anti-racism training, we need cultural change. We need our champions in the institutions that help the cultural change to happen. We're going to the next slide. The next slide is data and resources. We must disaggregate data by race, gender, disability in order to guide policies. One of our biggest shock was our meeting with the Sangamon Springfield Growth Alliance that had not any type of disaggregated data. And in fact, anti-racism was not one of their analysis or factors of analysis when they were analyzing how to assist the community. Equitable and transparent city and county funding processes needed. We are trying to redirect resources to grassroots community-led organizations, and we want to host summits to align the data and the commitments with the next steps. And that includes hosting a summit to talk about the Massey Commission recommendations. The impact of the inaction, which is the next slide, is inadequate data analysis will continue to mask the causes for inequity. Solutions won't match the problems, and inequitable distribution of resources will be perpetuated. Also, without substantial change in policy and funding, the data presented by the SIU School of Medicine at the April 2025 Commission meeting will continue to show glaring inequalities that result in dramatically lower mortality rates and shamefully high segregation index. Let's go to the next slide. When it comes to economic development and equity, we want these accountable bodies, which is what the Ferguson Commission talked about. You know, our accountable bodies are city and county organizations, 186 school districts, police departments, and so on. We want them to invest their time and their effort to create an economic equity plan by 2027. We want proportional representation of marginalized business owners, fair labor participation in development agreements, and end redlining and expand fair access to capital. We want to redirect that to the accountable body, and that includes, again, Springfield and Sangamon and Springfield Growth Alliance, private and non-for-profit organizations that help with funding. The impact of inaction, which is the next slide, is structural inequities persist, and marginalized groups remain underrepresented and excluded in policymaking and leadership. Minority-owned businesses remain excluded from the economic development, perpetuating cycles of inequity. And families remain unable to participate fully in the workforce, limiting economic mobility and sustaining cycles of poverty. The next line is small business and contractors. So we need, and we have recommendations, for support minority-owned contractors, and we need that support to include training, certification, and incentives. Those are our recommendations. Direct investment to disinvested neighborhoods, and flexible funding and loan programs for minority-owned businesses. The impact of inaction is that opportunities for minority entrepreneurs and low-income residents remain constrained. Historically, disinvested neighborhoods continue to lag behind in infrastructure. Minority-owned businesses face continued barriers to access to capital, limiting their ability to grow and compete. Home repairs are slow. Small businesses miss growth opportunities, and persistent disinvestment continues with unsafe neighborhoods and continued economic marginalization, which persists. Sorry, I'm going fast. I'm going to the next slide with education. We need to recruit and retain more Black and brown teachers, and that's our recommendation. We need to expand school-based mental health supports, reform discipline with restorative justice. We're not going to speak about this because Brian and who was the other group that was covering this? Kristen had part of it. And we want annual anti-racism and cultural responsiveness training in education. My experience has always been that when it comes to school districts, people like to talk about equity training and anti-bias training, and those don't necessarily include anti-racism training and cultural competencies, and we need that. We also need the cultural change. This is a school district under a consent decree that hasn't culturally changed for a long time. The impact of the inaction is teacher diversity remains low, contributing to ongoing segregation and inequitable education outcomes. There is a high turnover that disrupts student learning and school stability. We go to the next slide. We want to expand access to healthcare. So that means mobile units, health fairs, and navigators that are representative of our communities. We want to recruit more providers of color to build trust. The impact of inaction, which is the next slide, is marginalized populations may avoid care. Disparities in health outcomes persist. Trust in the healthcare system remains low. Delays in diagnosis and treatment worsen health outcomes. Persistent disparities in life expectancy and chronic illnesses rates continue in marginalized communities. Again, that's very tied to the SIU presentation in April. Housing, which is the next slide, we are in favor of recommending the creation of a housing coalition for affordable, stable housing, monitor fair housing violations, and homeownership initiatives and housing first models. Impact of inaction is that East Side residents remain in isolated, segregated, underserved, underrepresented areas lacking amenities, transportation, and economic opportunities. Rising property values displace low-income residents, disrupting social networks and community stability. And then there is gentrification, resident risk foreclosures, and so on. So basically, segregation persists. And the last slide, wow, I'm always there, is transportation and employment. So we want to expand the SMTD routes, conduct transit equity analysis, prioritize job development benefiting local residents, and exploitative tax incentives harming schools and neighborhoods. These recommendations are based on the fact that the impact of the inaction that residents face is continued isolation from employment and education opportunities, health and other essential services. There's also another slide that talks about segregation, inequities, and disinvestment deepened. Unsafe housing, poor health, and limited mobility persist. Minority-owned businesses are excluded from opportunity, and trust in institutions erodes and morale declines. So that is all.
Hello, hello. That is the end of our 4 groups and their presentations. I hope you enjoyed the discussion that you had at your respective tables with commissioners and the community. Before we move on and Kelly wraps us up,
They get 15 minutes.
Oh my gosh.
Joanne's trying to get out of here.
I'm sorry.
No.
You
They're
give
like,
it
we have to discuss.
You give it back to me, and I'm like, I'm the wrap-up person. I'm wrapping it up. Okay.
Hello.
All right.
I-
You
I
have
was-
15 minutes.
I was about to get up and do something.
Go ahead.
Kidding.
Oh, 15 minutes to discuss this 4th group. You can begin now.
I'm grateful that they worked with the Growth Alliance.
Okay, our 15 minutes is up, and I know Joanne's like, what? Now it is? Yes, it is. And I wanted to say a couple of things. Thank you. First, look, Dr. Cruz has already brought these to me. We will come around and collect these, but I wanted to say one other thing, and then I'm going to actually turn it over to you all so that you can make a motion to close us out. That we had on our agenda tonight public comment, and public comment is right here. Public comment is in the room, and it has been fascinating listening to folks and hearing about some of the things that you all are bringing up. Questions right at the very beginning. Have they thought about this? Is this something that we want to do? This is exactly what we're asking for. I want to give you all just a little bit of information that is beginning to just sort of formulate. First of all, we are going to take the month of October to work on writing this report. That is kind of our dedication to doing this. There's a small group of people, and then we would love to have some community members who are good, strong writers to come and join us, good, strong thinkers as well. That's really, really crucial to this. We hope to get some feedback and do some editing throughout the month of November, and we hope, are you hearing all the hope in my voice? We hope to be able to finish this and finalize it by December 1 so that we can present them to the county. One of the really great questions is, are all of these recommendations for the county? And the answer is not necessarily. You heard in the room lots and lots of institutions, organizations, and parts of our community that actually require this kind of work. And so that is our hope, and I am going to turn it over to Joanne, and thank you all so much for your attention to this. Thank you for showing up.
Okay. Thank you, Kelly. Before I make a motion to adjourn, I want to recognize, and I apologize for not doing this in the beginning of our session today, the law enforcement group members that are here. There were some that were here that had to leave, and there are some that are still here, and I'm just going to read everyone's name, and if you're here, if you would just please stand briefly. Deborah Anthony, the co-chair, was here. She had to leave. Jerry Castles is a part of the group. Sunshine Clemens, who could not be here tonight, is the other co-lead. Milas Copeland was a part of the group. Geraldine Dixon, she was here. Yes, she had to leave. Okay. Betsy Goulet was here. She had to leave. Zach Long, Austin Randolph Jr., Timothy Summer, former member, Tashiana Bankhead. Come on, Tashiana. And then Tatum, please stand up, because Tatum was our resident administrative assistant, did all the typing and note-keeping and everything. So thank you. Okay, with that, can I get a motion to adjourn? Second. From a commissioner. From a commissioner. Okay, thank you, everybody, for coming. Thank you.